Welcome to the UNCG MSAT Continuing Education Module on Evidence-Based Practice. This is Part 7, Evidence-Based Practice at the Ankle. Please complete all 10 parts in the quiz that follows to receive your CEU. Let's begin. In the previous sections, we have talked about the fundamental basics of evidence-based practice. We've seen an example of evidence-based practice in the literature, and in Part 6, we talked about using clinician preference, patient preference, and the best available evidence in making the most appropriate educated clinical decision. In this section, we're going to show one example of how we use evidence-based practice at the ankle joint when we're teaching our MSAT students. Clinical prediction rules is gaining a lot of attention and heavily valued now at the NATA. First thing we teach our students when looking at the ankle is the Ottawa ankle rules. This clinical prediction says that if you have tenderness at any of the locations A, B, C, or D, and/or the patient cannot bear weight immediately after the injury, 4 steps regardless of limping, that this individual may potentially have a fracture. If you look at the evidence, you will see this article from the British Medical Journal in 2003. This particular article is actually a systematic review reviewing multiple studies that determined the accuracy of the Ottawa ankle rules excluding fractures of the ankle. If you remember from Part 1, we talked about sensitivity, specificity, and the contingency table. Sensitivity, from Part 3, we talked about SNOUT. A sensitive test that is negative is good at ruling the condition out. In this case, the condition we're ruling out is a fracture of the ankle in the midfoot. Using sensitivity, we can see these values are much higher than the 0.75 that we consider to be good when looking at statistical tests. In particular, the top row, which looked at all 39 studies in the systematic review, revealed a total 97% sensitivity. At UNCG, the way we teach this is if you apply the Ottawa ankle rules and the patient is not tender in any of the locations and/or is able to bear weight and walk 4 steps following an acute ankle injury, you do not need to send them to the emergency room, urgent care, etc. to get an x-ray. Based on this rule, you are 97% certain that because the Ottawa ankle rule is negative, they do not have a fracture. We use this in the context, especially with our high school clinical rotations, where going to the emergency room or the urgent care can be a 2 to 3 hour ordeal with multiple different types of insurances, physicians, etc. This is one example of using evidence-based practice in a clinical prediction with our students here at UNCG. In the following sections, we'll be going through different body parts in a similar way, taking 1 or 2 special tests and looking at the evidence regarding them.